and welcome into To Your Health. We talked to Dr. Balasetti previously about strokes and about one of the major new ways that we can deal with that. We are so blessed to have him back with us again today. And today, Dr. Balasetti, we are going to talk about ways to try to stay healthy, to try to prevent strokes and heart attacks. And what are some of the things that if you want to try to stay away from having strokes and heart attacks, tell me some of the things that you should not do. What are the things that are harmful?
Yeah, so the risk factors for stroke generally include increasing age. Usually as you age, there is not much difference between men and women. So the risk is pretty much the same as you grow older. And these are non-modifiable. We cannot do much about these. But the modifiable risk factors, the main one out of that is the high blood pressure. High blood pressure, high cholesterol, diabetes, all of these, and high cholesterol are the ones that we need to watch out for. And high blood pressure, I would say about, especially in the South, the risk for high blood pressure is, it's pretty much prevalent here. And that's the reason why we are in the stroke belt. If you've ever heard of this term, the southeastern states, 11 of them comprise or make up the stroke belt, where the risk for stroke is pretty high, and our mortality from stroke is also pretty high compared to the national average, but 30% higher.
Wow.
So, and as we know that African American population is a little higher down south, and if you look at the studies that looked at prevalence of high blood pressure, that's also higher among the African American population. Apart from that, smoking is a very big risk factor for uncontrolled high blood pressure, and risk for blockages in the blood vessels, hardening of the blood vessels. That in turn leads to higher risk for stroke. So checking your blood pressure regularly, that's what I always tell my patients, that to check their blood pressure every day, if not every day, at least 3 to 4 times a week at home. Write down those numbers, so when you go to your primary care doctor, you have those numbers with you, so that the doctor knows how your blood pressure has been over time, so that they can adjust your medications accordingly. And regular exercise, that helps with the blood pressure. And I usually tell you don't have to be hit the gym and do that extensive or kind of workout. It's just a brisk walk, 20-30 minutes a day, 4 times a week, should help, should make a great difference.
You touched on in the South, and this being a very bad area for the high blood pressure. What is that attributable to? I
think it's partly genetic and partly the environmental factors and the dietary factors. The fried food we eat here, and smoking. Yeah.
Okay. So if you live here in our audience anywhere, would you say that 2 things that are very important: cut out all those fatty foods. You can have some, it's fine. It's true, everything in moderation.
Yes, that's correct.
So the top 3 things that you would tell our audience to change to try to avoid the possibility of strokes and aneurysms would be what 3?
Number 1 would be smoking.
Okay.
Yeah, that's the number 1 risk factor for aneurysms and for strokes. Smoking leads to increase in the size of the aneurysms if you have one, and also increase the risk for it to rupture. And at the same time, everything goes in circles. Smoking leads to bad high blood pressure. Bad high blood pressure leads to increased risk for strokes and also aneurysm rupture. So definitely no smoking, and then more of green leafy vegetables.
Okay.
People like that, but the Mediterranean diet is what has shown to be effective in controlling the blood pressure. So high blood pressure is directly proportional to weight gain, so weight.
Right.
Yeah.
Right.
So weight loss helps with blood pressure, and so the Mediterranean diet helps with that. And then regular physical exercise.
Okay, the top 3. And it's nice to know that there is something you can do about it. I mean, I love the fact that, let's say you've got high blood pressure, unfortunately you're on medicine, you want to get off of everything you possibly can, and if you lose weight and change the way you eat to something healthy, don't smoke and get some exercise,
Yes.
you can actually change all of this. So that's what we're trying to get our audience to do. Take responsibility for your health. You can live better. And thank you for being somebody that helps us to live better. Thank you, Dr.
Absolutely.
Balasetti.
Thank you.
And we'll be right back.